Tell our viewers, what you do here, what you find exciting about the company, and what you're enjoying at the conference.
So I'm the managing director for healthcare and life sciences at Tableau.
Yep.
What that means is I'm responsible for leading Tableau's businesses for healthcare provider, payer, pharma, and med devices. Segments that I'm extremely passionate about. I do this for much more than a living. I'm very passionate about healthcare. I've lost my mother at 58. We've had healthcare issues with my family. So it's literally my mission in life is to be able to use this fantastic technology like Tableau that is helping physicians, doctors, nurses, clinicians, business analysts in a healthcare context make life-impacting decisions that at the end of the day is touching lives of patients like you and me, right? So that's what we do.
That is very cool. And what types of data do healthcare companies have? I know it's a very compliance, very regulated space. What types of data do you see flow through, and what are the customer concerns around that data?
So just some context, maybe a little long-winded, but healthcare is going through probably what I call a renaissance, unlike anything we have seen before, right? The big thing is, again, this move from fee-for-service, where they were literally a factory moving patients through and treating them, to this notion of population health management and accountable care organization, and the key word is accountable.
Okay.
So they are now, for the first time, responsible for the well-being of the patient beyond the treatment in the hospital. Exactly. So that's a fundamental shift.
Okay.
So what that means is now fundamentally 4 pillars, if you think, right?
Okay.
So this notion of being able to do not only patient management, but population health management. And that's a challenge because healthcare has probably more different kinds of IT systems than any other industry. I've worked across 7 industries.
Right.
Healthcare has more industries, more systems than anyone else. So trying to bridge those silos and what I call bridging the data divide with a visual analytics platform like Tableau is what we are seeing visionary healthcare providers do. And the most important thing where Tableau plays a really important role is key to enabling all this is empowering the doctors, clinicians, nurses at the point of care with the data they need to be able to treat patients, right? Or the case managers who's now responsible for the patient beyond discharge to ensure that he or she is compliant with medications, is keeping her appointments, etc. So, the data across that continuum is key, and that's the role that Tableau is playing. So to answer your question, we're doing everything from Barnes Jewish Healthcare, great customer of ours, using Tableau for supply chain management, for strategic sourcing, identifying where the same catheter is being sourced from 7 different device manufacturers, which makes little sense. And they have saved over $212 million
oh my gosh.
over a little over 3 years with Tableau and some of the other systems they have in place. Let me talk briefly about Cleveland Clinic. Needs no introduction. The foremost cardiovascular healthcare, provider in the world.
Okay.
They started out with this little deployment to make the fundraising process more efficient, and Tableau's now provided the visibility, the real-time visibility for everyone from that fundraiser to the analyst to the CEO to see how well they're doing on meeting their $2 billion target and segmenting their donors. So a fundraiser calling on someone knows whether this is a donor that is disposed to donating for cancer versus heart disease.
Interesting.
They actually spoke yesterday, amazing presentation, $125 million raised in 2014. And that has actually been the genesis for a far bigger deployment of Tableau, where they built out an entire population health segmentation solution with Tableau. Third use case, I'm about to go into that presentation. Mount Sinai Medical Center in New York, one of our newest customers, deployed Tableau for about 18 months. Within weeks, they had an emergency room physician who so fell in love with the ease of use and the flexibility of Tableau. See, that's a challenge. Physicians and doctors are not PhDs in data science.
Yeah.
They're not pivot table jocks. So for the first time, they now have a tool that this ER physician would moonlight with after his or her day job, and actually identified $125 million in revenue leakage from analysis of the denials data.
Oh my gosh.
So that is the level of value that healthcare providers are unleashing by providing a self-service data discovery and visual analytics tool in the hands of doctors, nurses, clinicians, business analysts who otherwise had to wait for 2 weeks to 2 months to get a dashboard with some of the legacy tools they've had. And the other amazing thing, the way we add value is it's not rip and replace. We coexist in a world where every healthcare provider has made $10 to $30 million of investments that are kind of now sunk cost into legacy BI tools.
Yeah.
Very robust, big stacks, which take 18 to 24 months to implement.
Sure.
Now they can add Tableau on. Tableau complements the Tableau is, think of Tableau as the Switzerland of analytics. Yeah. I think it's a good metaphor to think of. So it brings together all of those data from those legacy IT systems, couples with the Excel spreadsheet sitting on a dashboard, with data sitting in Cloudera or some Hadoop cluster, and makes it very meaningful for that clinician, doctor, or a nurse. It's a long-winded answer. Hopefully that answered some of your questions.
Fantastic depth. I love it. Yeah. One thing you mentioned there right off the bat was the immense fragmentation in the healthcare space.
Yes.
What does a typical healthcare look like? Where does their data come from? Are we talking like old systems, 20, 30 years, legacy systems that maybe can't even speak HTTP? Give me the full picture of what a typical healthcare provider looks like.
So one of the things about healthcare, big learning for me, having worked across 7 other industries, if you compare healthcare to Procter & Gamble, for instance, right? A big CP company or a big retailer. A lot of that is centralized. It's top-down.
Yep.
In sharp contrast, what makes healthcare very interesting and also the fragmentation is it's very physician influenced.
Okay.
And physicians have influences within their specific functions and their specific therapeutic area. So if you think about it, right, you have HR, finance, clinical, etc. Now within clinical, you've got cardiovascular, you've got radiology, etc. So we have systems within each of those silos, and then each of those silos have also made selections for what their analytics platform is.
I see.
So it's really compounded, right? It's exhaustive. You have this fragmented, disparate systems, radiology, cardiology, HR, ERP, EMR, and also kind of the analytics system or platform of choice, which is also sitting in those silos. So the magic, the panacea that's needed, in my humble opinion and based on experience, is a thin layered, like a visual analytics platform that can not only integrate easily with those systems, with those analytics systems, with those multiple data systems. You mentioned legacy systems, there's a lot of that as well.
Right.
With Excel spreadsheets, which nurses and doctors are being forced to use. And how do you make that all together, bring that together? And also, this paradigm shift from I need a dashboard and it's delivered to me in 2 weeks to 2 months where it's irrelevant.
Sure.
To I now need to interact with the data, ask the questions I need, and be able to ask and answer those questions in minutes and seconds. So that's a huge paradigm shift. And Tableau is happily enabling that. Let me talk about 2 quick examples.
Absolutely.
Providence Healthcare.
Okay.
Headquartered in Seattle, literally grew by acquisitions, is officially the 2nd largest healthcare provider in this country.
Wow.
They just presented yesterday. What they have done, amazingly, is create this in an environment with business objects, with SaaS, with Cognos, with Epic as their EMR, literally create this operation analytics platform called Vantage, which is built entirely on Tableau.
Okay.
So that aggregates data from 11 disparate systems, including some of their legacy platforms.
Cool.
And they provide 40 standard reports that is used by everyone from the CXOs down to the business analysts, the doctors and analysts.
Very cool.
And it's fascinating because you hear all these metaphors about cascading hierarchy of metrics. You hear about the balanced scorecard. You hear about a single version of the truth. They've literally brought that to life. So they can go from a provincial or a regional level down to a healthcare provider level, down to a physician scorecard, all with one set of meaningful metrics, with all the incentives aligned, that the entire organization is literally using as a single version of the truth with Tableau.
That is very cool.
And the numbers they put out are pretty astounding. I mean, physician productivity has gone up about 12%. They're an organization. They've rolled this system out about a year back. Right. They already have 20,000 users on the system, which is growing at about 15 to 20% every month. And their cancer screening, they actually have metrics for screening, pre-screening people for colon, colorectal, and breast cancer.
Yep.
Those have seen double-digit, growth, and now they are literally on that fascinating journey of seeing improved productivity, improved performance, and financial impact of being able to do this. So back to that vision, right?
Very, very
that
cool.
Single version of the truth in that disparate landscape powered by Tableau.
Very cool. And is Vantage now, I didn't really understand, is that a product that you guys offer, or it's something you custom built for them?
No, so Vantage is literally, they branded their Tableau platform, Vantage, but it's really built completely on Tableau.
I see. It's not something they're trying to resell, it's just something they're using in the company.
It's just, they wanted to brand it, so it's Vantage, think of it as Vantage powered by Tableau.
I understand.
Yeah. So the other equally compelling instance is Blue Cross Blue Shield of North Carolina.
Huge, yep.
Right? One of the biggest payers that you can think of. Similar thing, they started with a very small adoption of Tableau, saw viral adoption. Here's a fundamental difference. Unlike a lot of those legacy platforms, which is a sale to the office of the CIO and then top down.
And then never gets implemented correctly? Yes.
Tableau, by sharp contrast, is an amazing story. What fascinated me to come to Tableau is a business analyst literally downloads a free copy of Tableau Desktop, plays with it for 14 days. His life is changed because he sees himself saying 8 to 10 hours per week versus Excel and Access. He buys a copy with his credit card, puts use cases out, goes viral across his department.
He starts becoming the rising star. Everybody's like, what's he doing?
What's
his secret sauce?
Well and truly, we have, so Tableau is built for the business user from the ground up.
Sure.
And I think I can humbly state, and you'll see this in this conference with 9,000 people, is we have turned the business analyst into a rock star.
Yeah.
The business analyst from Cleveland Clinic who presented the philanthropy department, he'll tell you that the CEO of Cleveland Clinic now knows him.
Yep.
And he's got it promoted twice over. You see that as a recurring theme, right?
Sure.
These business analysts who were confined to the back office at one time are now visible. They are the data rock stars. They can stand up in front of CXOs, not with Excel spreadsheets stuck on PowerPoint and a question they're not anticipated, and I'm going to have to come back to you.
But live updatable graphs.
Now they can literally query the data and answer their questions. And that is a fundamental shift, right? It's literally putting data in the hands of the people that need those insights to be able to make decisions, and that's driving fundamental. So we have turned the business analyst into rock stars. We have turned emergency room physicians and nurses into rock stars. In the next presentation, Bound Sana will talk about how a nurse with no previous knowledge of Tableau built out a patient satisfaction dashboard that is now a tool used across the enterprise. So back to Blue Cross Blue Shield. Again, they've deployed it across the enterprise. They just did a webinar. They did a presentation here. They speak about 1,000% ROI on their Tableau investment. They actually put together, this is an amazing story. Their case managers would take about 25 to 30 minutes to prepare for a call with a patient that would call in.
It's a lot of time.
They aggregated this data from 14 different data sources.
Sure.
They've aggregated it into one 360-degree view of the patient case management dashboard.
Great.
So now the case manager, patient calls in, no prep needed, the dashboard is real time, right?
Wow.
Which is phenomenal. And he'll also tell you, one thing he says is, they did this from prototype to production in 90 days, entirely on Tableau.
Oh my gosh.
Which otherwise, by their own admission, would have taken them 12 to 18 months and a small army of consultants using some of the legacy solutions to build out. So think about that, right? That's a game changer.
So is that what did everybody just lack the analytics before a product like Tableau came along, or did they all just kind of pay those massive amounts of money and wait forever for the...
Exactly. It was hiring a army of consultants. Now, they have these little centers of excellence, business analysts who are creating governed data sets, putting out some initial visualizations and analytic reports, and then setting them free. I mean, it's literally, again, the democratization of data. Right. It's enabling that ER physician to uncover $125 million in value. Totally. It's enabling care coordinators to exactly zero in on the high-risk patients that they need to focus on so they don't incur those penalties, right? It's that nurse case manager who now has data on that patient at her fingertips without the need to call someone, to be able to query the data.
Very, very cool.
Which is pretty amazing.
Unfortunately, healthcare is one of those spaces that is working with very sensitive data as well, obviously. So can you walk us through an example of maybe a customer that came to you and said, look, we love what you guys do, it looks great, the analytics, we get it, everything makes sense, but data X, Y, and Z we're really concerned about. We want to expose it to some people, not some others. How can you make us that guarantee that when we do this, it's auditable, it's compliant, we can go through and check off all the boxes that we need to remain in compliance? So
in full transparency, today Tableau we do not sign the BA agreements to be able to handle PHI. Fortunately, we have service provider partners who do that.
Do you have a name of a couple of them?
Sure. ClearSense is a partner we are just bringing on board.
Great.
We have Prominence Advisors, which is building out apps literally to extract data from Epic and render it into Tableau, which would sign a BA agreement that would enable our healthcare provider partners to work with PHI.
Cool.
So that's how we kind of address that.
That's great. And another question to kind of wrap up here, so the IoT space is obviously something that can help a lot with this, right? Are you guys seeing, do you have any like cutting edge use cases out there where folks are taking some data from that and sort of looking at, the great thing would be truly personalized healthcare that I can tell, I can send somebody an alert when it's time to take their medication and maybe even send it to their family because grandma forgets sometimes. Do you have some companies out there doing some cool things in that space?
I'm so glad you asked the question. That was our last presentation in the healthcare track, HCA. The largest healthcare provider in the world.
HCA.
Yeah, the Hospital Corporation of America.
Got it.
Largest healthcare provider in the world. Still early work, but they literally, the last dashboard, the last Tableau dashboard they put up was an aggregation of blood pressure, sugar, vital sign data on patients aggregated from multiple medical devices, which a physician or a nurse practitioner could literally look on her iPhone or her iPad before she went into the patient. Now think about that. I mean, there are obviously issues around PHI compliance, regulator, but imagine a world where that is feasible. And now things around population health management, right? You literally don't need complex risk scoring happening in the background.
Right.
A doctor goes in to see a patient in ER, has not only the data, but again the associated risk scores, telling them, and this is not fiction. We again have partners. Yeah. JVion is an interesting partner out of Atlanta, JVion.
Okay.
And they use Google-like predictive risk analytics on Tableau and R for a physician, an emergency room physician that comes into the morning, has 20 patients. They can actually see a risk score with the economic impact, saying, here's a patient who's at risk of overstaying the length of stay.
Wow.
And you really need to monitor him beyond discharge because he could impact your 30-day readmission rates.
Very useful.
So those things are happening. And again, at the end of the day, devices, trackers, etc. So the Internet of Things, we're probably not making a big deal, but literally that's what is coming together. It's big data, mobile devices, Internet of Things, literally converging in front of our eyes. Yeah,
totally.
It's fascinating.
And Andy, you've given us some great presentations. Can you just run back through folks that are really interested in healthcare and maybe if they didn't get a chance to see some of these presentations or if there are ones coming up, what's on the absolutely must-see list for these folks?
Absolutely. So the good news is a lot of our presentations in the healthcare track will all be archived and available. So strongly encourage you to see the one from the Cleveland Clinic, game-changing. We had amazing presentations from Mount Sinai, from Piedmont Healthcare, from HCA, from Kaiser Permanente this morning, from Barnes Jewish. Just look out for these.
All the biggies.
Exactly. And the great news is I've had the good fortune of working with all of them, been an amazing learning experience, and they're all value-based presentations which will literally drive impact for every healthcare provider. Blue Cross Blue Shield of North Carolina, amazing presentations to watch out for.
Fantastic. Andy, thank you so much for that deep dive into healthcare, and we look forward to seeing you again.
Appreciate the opportunity.
Take care, absolutely, thanks.